Hello, welcome to the first CARSP Safety Network newsletter video interview. My name is Dr. Emily McCullogh, and I am a postdoctoral research associate at York University and member of the CARSP editorial board. Today, I have the pleasure of interviewing Dr. Linda Rothman, associate professor in the School of Occupational and Public Health at Toronto Metropolitan University, prominent injury prevention and road safety public health researcher, and advocate for active and safe travel in the city of Toronto and beyond. Dr. Rothman will be sharing insights from her experiences working with municipalities on road safety initiatives, including the adoption of Vision Zero in the city of Toronto. Dr. Rothman, welcome.
Thank you so much for having me today. I'm very excited to be talking to you.
Wonderful. So let's start. Can you tell us a fun fact about yourself?
So I love this question. I always start my undergrad classes at the beginning of the semester talking about this, but I started university many years ago thinking I was actually going to be a classical guitarist. So I took music in my first year and some of the basic arts. And I keep thinking that my great math teacher in high school would be absolutely shocked if he knew what I was doing right now, because he used to let me bring my guitar to class and play, as he knew I hated math and I had no interest in it. And if he knew I was doing biostatistics on a daily basis now, I think he would explode, not knowing what to do with that information. So as I say to my students frequently and my kids, to keep your eyes and ears and hearts open, as you never know where you might end up career-wise. Just take any opportunity that you have and follow your instincts.
Wonderful. Thank you for sharing. So how did you get involved in the injury prevention and road safety world?
So I started off after my initial music career, kind of, as I went on to do occupational therapy because I had the eye to do music therapy ultimately. But what I ended up doing was working with children with neurological impairments in a rehab center. And this included traumatic injuries. So I was doing rehab with disabilities as a result of catastrophic injuries. I decided after, I think, 6 years of being a clinician to go back and do a master's degree. And in those days, there was no degree in rehab sciences. I ended up in a program called Masters of Health Science and Community Health and Epidemiology at the University of Toronto. And I think that was one of the precursors to the MPH program they have there right now. And it was a great experience. And after I graduated from that, I decided I wanted to continue working with pediatrics, but in prevention rather than as a clinician dealing with the results of injuries. I was really fortunate to get a position with Dr. Andrew Howard, who some of you may know, who is an orthopedic surgeon and senior scientist at the Hospital for Sick Children, and he's an injury prevention researcher. The first project I was hired on to do as a research manager was looking at kids who came into hospital as a result of car crashes and looking at what happened to them in the car. Basically, we worked closely with a collision team, a collision reconstruction team of engineers out of actually the old Ryerson, Toronto Metropolitan University, to reconstruct crashes and see how the car seats failed for these kids. And this actually ended up resulting in the design for a new booster seat for the older kids, which was really an interesting experience. And this really just started my career in injury prevention. After that, I worked with Dr. Howard on things like playground safety and body checking in hockey. We also looked at a whole bunch of aspects of different types of car crash and collisions. And then eventually we moved to looking at vulnerable road users, so pedestrian and cycling injuries in kids, because we started realizing that we're keeping kids quite safe in cars. It's the kids who are out of the cars that are having more catastrophic injuries and are the ones resulting in hospital admissions and surgeries and things like that. So my career kind of has moved more and more towards road safety. I eventually did a very late PhD, as some of you know, looking at the built environment and linking the concepts of active transportation and injury together, because at the beginning, people were just trying to increase active transportation without thinking about the injury implications. And specifically in children. And now this is kind of expanded. It is the continued focus in my program, but I'm looking at all ages, especially since coming to TMU. But also I kind of become much more focused on the healthy cities approach and the role of public health in road safety.
Mm. What a fascinating journey. Thank you for sharing. Uh, so, what was your involvement in the adoption and implementation of Vision Zero as a road safety strategy in the city of Toronto?
So it's funny, and I'm trying to remember how it all came about. I think it started off with a Metrolink Safe Schools Committee. I met some of the people from transportation in the city of Toronto, and they asked me in 2017 to become part of they had a school safety zone committee. And this was right at the beginning of the implementation of Vision Zero in the city of Toronto. We worked together as a group, and it was quite a large group, and on developing prioritization list of schools for interventions to start off with. And basically the prioritization list was based on KSI, killed and seriously injured collisions in kids and in other people, and the percent of the population that were able to walk to school within 1.6 kilometers of a school. The interventions at that point were things like speed symbols, flashing beacons, a few pedestrian crossovers, a few watch your speed boards. And we evaluated 34 schools with some match controls, and we didn't find huge differences before and after the interventions. A little bit, but there was a little bit of a reduction of drivers going over the speed limit. And there was a little bit of increase in active transportation. But basically what the takeaway from that project was, we need to be a little bit more bold or aggressive with some of our interventions. And it can't just be what I have frequently called lines and signs. It needs to be actual changes to the roadway to slow traffic down, basically. And, at the end of the day, there were still large proportions of cars driving past schools above the speed limit, which is something we really need to do something about. We also did a school survey of 3 of the schools. We did a parent survey, and we found huge differences in schools on the percentage of kids who are actually coming to school or reporting coming to school by active transportation, from 25% up to 98%. And we wanted to look at reasons why this was happening. So that was the beginning of it. And then as things progress with Vision Zero, I've maintained my relationships with the city, and we've been involved with most recently an automated speed enforcement evaluation with Dr. Howard and the team at Sick Kids and at TMU. And the automated speed enforcement has gone in around schools and community safety zones. So that some of you may have heard me present, or Sora present, bits and pieces of that project. We found a great deal of effectiveness in terms of slowing speed down with the automated speed enforcement. And there's been a lot of interest from other municipalities on how we did the study and what was the methodology and things like that. Because again, we did find great success with automated speed enforcement, and that paper should be coming out in the next year or so, I hope. There is a report on the City of Toronto website from that study. The important part about that is, though, we do know, based on another small study we did years ago with the Chase grant, if anybody remembers the Chase grant, that there is a pretty strong association, particularly in the City of Toronto, between speeding and the numbers of kids walking to school. So we want to make things safe, but we also want to make things perceived to be safe, so parents feel comfortable letting their kids walk to school in order to increase that active transportation. The other Vision Zero project that we've also very recently been involved in is the evaluation of the cycle tracks that went in through active TO and during COVID-19. And the city had asked us for some input in a quick evaluation to support their argument for at the municipal level to make them permanent in 2021, I think, in December. And that was passed through City Council, that those lanes were made permanent. And we are continuing that study right now with Calgary and Vancouver and Toronto to evaluate a whole bunch of the cycling infrastructure in terms of collisions over time. So that's how I got involved, and I hope to continue to be involved with this type of work.
Wonderful. So those projects in the other cities are ongoing.
The cycling infrastructure one is ongoing with Vancouver and Calgary, and we also hope at some point to add Montreal in. It's just a bit of a challenge because we need, which I'll talk about a bit later, but installation dates of when everything's installed to be able to look at what the effects of the infrastructure is on the actual collision rates.
Great. And that does lead into my next question, which are what are some of the challenges or barriers when working on road traffic safety initiatives, including Vision Zero, with the municipality?
So it's been an interesting journey because I realized right from the beginning that we have different perspectives. Researchers and municipalities have different perspectives of what how we want to do things and what is important. And we really need to be able to communicate and speak each other's languages. And I think it's more on the researcher side to actually learn the municipality language rather than the other way around. And the more time you spend with the municipalities and surrounding yourself with the engineers and the decision makers and the politicians making the decisions, the better you can get at this. And it's really important because in order to make your research relevant and timely, you do need to be able to address the needs of the municipality that you're working with and not go off onto an academic journey that's not going to help anybody or anything. So some of the challenges that I found over the years is, first of all, funding. So academic funding cycles and timelines are very different than municipal funding and timing cycles. And they may be able to provide you with some money in terms of doing a project, but usually you do want to try and get additional funding through one of the tri-council grants or something. But again, our granting process is extremely slow, and that is not how politics and municipalities work. If something's going to be done, it's got to be done much more quickly than our funding cycles allow. So there's always a challenge of balancing, again, let's face it, we're academics or researchers. A lot of our career is getting these grants and scientific publications, but it doesn't always match up with what the municipality needs. So that's one thing to consider. The other thing is the rigorousness of methods. We want randomized control trials. That's the be all and end all. We want to be able to randomize which intersections get this and which intersections don't get it. We want to be able to have control locations. But a lot of the time, the reality is if you're working in a municipality, there are political and community priorities. And no matter what you say or do, there's still going to be political and community priorities. You hope that they really try hard, and it's become more and more apparent through the Vision Zero process that the municipalities are really trying hard to make data-driven based decisions. But these are always tempered somewhat with some of the political necessity to do certain sites, which is totally understandable, but it doesn't really work with randomized control trials. So we have to be able to be adaptable to that. There's other quasi-experimental designs you can do that are a little bit more flexible. The other thing is sometimes there's a lack of N or numbers. We like to have a lot of power in our study, and sometimes what they want is just a few locations. So you have to look at different ways of evaluating those rather than our very rigorous quantitative methods, whether it's a process evaluation, qualitative research, things like that, if we don't have enough numbers. The other thing that I found really interesting when we did the, was it the Vision Zero study? Yes, the Vision Zero school safety zone study was that you have your number of schools, 34, and then partway through the project, all of a sudden the government gets the municipality gets more money to add schools. So all of a sudden your N has changed and your whole design is kind of messed up. So there's all these methodological things that you have to work on being flexible, being an adaptable researcher, not sticking to what you think is absolutely the way to go so that it's relevant. I mean, ultimately, you need to make things relevant. The other thing, what I found interesting was how do you define the interventions? So like I said, the city originally did the lines and signs. There was no evidence base that these worked. and they really didn't work great, and they still don't work great. So by talking to your municipal partners, they start to realize the value of having an evidence base before you start putting an intervention in. But sometimes things have to be done quickly, and that's the way the municipal politics work. And so you do have a bit of a push me, pull you of, we need to spend money on things that actually work, but it might be a longer term solution, and they might be higher costs, which is a big issue. So again, another way to thing that you need to negotiate on. The other thing that plays into this is we need this program evaluated. We need our cycle tracks evaluated, or we need our whatever it is that they're doing evaluated. And then you go and say, okay, when were they installed? So I mentioned this previously, and they're like, oh, that must, well, we're not really 2019 or maybe 20s, or they have a list of the years, but not specific enough. And in order to do a proper quantitative evaluation anyways, we need to know the actual dates that things are put in order to know what happened before and after. And to date, the cities aren't great at keeping track of those. I'm sure it's somewhere in construction orders, but it's been a real challenge to getting evaluative research done with the municipalities. The other thing is defining with the municipalities what the relevant outcomes are. Is it speed? Collisions take a long time. You need a lot of post-intervention, because luckily we don't get that many collisions, but collisions are a hard thing to measure if you have a short period of time. So you need to negotiate what are the outcomes that the municipality is actually wanting to get at, and what they're going to do with those outcomes after. So I think the second part was facilitators. Is that correct?
That was my next question. Yeah, on the flip side, what are some things that help move this work forward?
So, and again, it kind of leads into the next question as well, but and it's quite simple in the sense that you have to start meeting right from the beginning of the project. And it's easiest when a municipality comes to you and asks for help. It's not so easy the other way around when you have an idea. But if you have great relationships with your municipal partners, they're pretty amenable to do other things that are related. But you do need to meet together right at the beginning. It has to follow integrated knowledge translation. They have to be totally a part of every step of the decision-making process. And as a result, you need strict regular meetings. I think the automated speed enforcement, we're meeting every couple of weeks, that the whole, like the municipal team and the academic team. And through that, you're relationship building, but you're also developing a research strategy that makes sense to both of you. So I think that's the most important message.
Thank you for sharing. And just for our viewers, the next question was if Dr. Rothman had any advice for university or college researchers who are interested in working with municipalities and vice versa. So is there anything else you'd like to add to that?
Yeah, so again, it's really important to make yourself known to the municipalities and know who your team players are at the municipalities. You really have to keep in mind, especially for big cities like Toronto, which is who I tend to work mostly with, that there's a lot of change within the transportation department. People get moved around all the time, or they move into different jobs. But what I'm starting to realize, I attended the Ontario Traffic Council Ontario Traffic Council forum yesterday, and it's all the same players. They're just in different jobs now. So somebody I worked with 10 years ago just happens to be a different position. And if you are good at remembering who everybody is, ultimately you're going to end up working with that person again on a different project. So I wouldn't get thrown by the fact that people change all the time within there, but just keeping track of who and what they're doing is really important. How do you make yourself known? And we were talking about this previously. You need to get out there and not just sit behind your desk and write academic papers. You need to go to the forum, the Ontario Road Safety Forum, the one like I was at yesterday. There are municipal representatives from all over Ontario at that forum. Go to conferences like CARSP, the Canadian Association of Road Safety Professionals. Ontario Traffic Council has a great meeting. Go to TAC. These are things that the municipalities attend. I would try and present as many of these as possible with with an eye to presenting to municipalities rather than academic researchers. And as part of your presentation, I would even have a slide saying, this is what I can do to help, so that they have some idea of who you are, what you're able to do. And get involved in these organizations, sit on their boards, sit on their research planning committees, they want you there. And it really, really does help to make your research relevant and give you excellent perspectives on what's happening on the ground. The other thing I would really suggest is keeping your eyes open for funding calls, both within and outside the university. So sometimes municipalities reach out directly to the universities. For example, the City of Toronto has an innovation challenge that they keep sending projects to TMU that you can respond to the call. Things like the MTO, Road Safety Research Partnership Program, they value municipal partnerships on some of their projects. Even the CIHR Healthy Cities program, they're really focused on cities. And if you want to, apply for that type of funding, that would really help as well.
Great, wonderful. Thank you for sharing. So based on your experience, what would be one of the most effective interventions for road safety?
So that's hard to actually pinpoint a specific one, because I do think it's a program of research that you need to be doing, or road safety implementation. But the bottom line is a lot of it needs to be focused on speed and reducing speed. We know that speed is highly correlated with the incidence of collisions. We know it's highly correlated with the severity of collisions. The World Health Organization has recommended 30 kilometers per hour where there's vulnerable road users. So anything to reduce collisions, whether it's there's lots of evidence out there on traffic calming. There's lots of evidence now on automated speed enforcement. There's actually quite a bit of evidence out there based on reducing the posted speed limits. We've been involved in all these projects at some point. And that to me is like the most important target to be hitting, is the reduction of speed at this point. You can also work on separating vulnerable road users from traffic in terms of time and space, the cycling infrastructure, some good pedestrian infrastructure. But I think the bottom line is to get that traffic speed down in urban areas, especially where there's vulnerable road users.
Thank you so much. So we're coming to the end of our time here. Is there anything else you'd like to share before we close, Dr. Rothman?
So just to reiterate, my bottom line take-home message is get to know your partner municipalities. Make sure they know and trust you. Devote energy. You might not think it's a great way to spend your time in terms of academic output, but it's really important to devote energy to engagement through a huge variety of forums in the community and at the municipal level. Sometimes working with one municipality, and this happens frequently, ends up leading to working with another municipality. So that's something to think about. And developing these relationships are absolutely necessary to ensure your research is relevant and can help make a difference.
Thank you so much. And I'd like, on behalf of CARSP and our audience today, again, a big thank you for sharing your experience and wisdom with us. We hope to see you at the CARSP conference, June 16th to 19th in Ottawa. And have a wonderful rest of your day, everyone. Thanks again, Linda. And until next time.
Okay, thank you. Thank you so much. Bye-bye.